Hey, Dr. Charlie Johnson, physical therapist at Physical Therapy in Johnson here, and I want to talk a little bit about where do you hurt, and where do you feel your knee pain. So just in a moment here, you're going to be looking head on at my knee, and I'm going to talk a little bit about where you might be feeling pain if you have problems within the joint, or where you might be feeling pain if you have other problems outside of the joint. So check it out. We're going to review the different places where you feel pain now. Okay, everyone, so you are looking at my wonderful knee here, okay? So this is a straight-on shot of actually my right knee, okay? So what I want to do is I want to walk you through some of the different areas. We talked about the different types of knee pain, one being inside of the joint, the other being outside of the joint, and then some other causes outside of the knee completely, okay? So you're looking at my knee. Here is my kneecap, right? This is actually the inside of my knee. This is the outside of my knee. This is above my knee, and this is below my knee, okay? So inside of the joint, we talked about how some ligament tears, you'll have meniscal tears, arthritis, things like that can cause stiff and painful knees. And remember I said that you can have pain on the inner joint line or the outer joint line in cases of, say, a meniscal tear, which is really common, or arthritis. Often you'll feel it right along. If you kind of follow your finger down the inside of your kneecap, you can kind of hook around the bottom part of your upper leg bone and go right into this line here. And you'll often have people point to this and say that's where they feel their knee pain. Sometimes you can also feel it behind the knee and or on the back outside of the knee, but a lot of times it's right along this line where the two bones meet. Okay, that's often a problem within the joint, meniscal tear, arthritis, things like that. And if you have pain that just kind of, underneath the kneecap, it's a little bit over here, it's a little bit under here, it's over here, then a lot of times that is a problem, again, underneath the kneecap. So patellofemoral problems can cause this, where there's a maltracking of the kneecap and underneath the kneecap is getting irritated, all right? Another place to kind of look is actually right underneath the kneecap. So directly underneath this on either side, sometimes you will get some tenderness through here. And if you have tenderness there, and when you go to try to lock your knee out, straighten your knee out fully, you get like a pinching and painful sensation in there, then a lot of times that's a problem with the fat pad. That's where your fat pad is located, okay? And then just below here, this little bump on your lower leg bone is right where this tendon, or the quadriceps tendon, comes up and over, attaches. And you can get some tendinopathy or tendinitis of this patellar tendon. So that would be patellar tendinopathy or tendinitis. Again, an overuse of this tendon, okay? So, and then the IT band attaches just kind of down here on the outside of the leg. So if you have some outer knee pain, not on the joint line, but seems like it kind of travels down towards this lower leg bone, then you could have some IT band problems, okay? So just wanted to give you a close-up of some different problems that could indicate within the joint and kind of outside of the joint, and what those feelings and where you're feeling it could mean. So hope that helps.